current UK population incidence and prevalence suggests that it is the commonest male cancer diagnosed currently. One of the problems that we face in primary and secondary care is that the reality is that for many men, the symptoms of prostate cancer are pretty much the same as the symptoms of benign urological disease that we treat on a daily basis.
Symptoms of prostate cancer can include lower urinary tract symptoms such as nocturia, urinary frequency, hesitancy, urgency and retention. If a patient reports any of these symptoms, then NICE referral guidelines suggest that a digital rectal examination and a PSA test are considered. Similarly, for men presenting with erectile dysfunction, a digital rectal examination and PSA test should be considered. Also, blood in the urine can be a sign which might warrant further investigation. NICE recommends that both digital rectal examination and PSA test are used in combination. It's a good idea to perform the digital rectal examination after taking the PSA test. And if the prostate should feel enlarged or malignant during digital rectal examination, or if the PSA test shows levels above the age-specific reference range, then the patient should be referred using the 2-week wait referral pathway.
One of the diagnostic tests that can be helpful in diagnosing or indeed excluding prostate cancer is the PSA blood test. PSA stands for prostate-specific antigen because it's a protein. It's a normal protein found in seminal plasma. There's a huge quantity of it in terms of concentration in seminal plasma, and a small amount leaks into the bloodstream, so therefore we can detect it on a fairly standard venous blood sample. Currently in the UK, a PSA value of 3.0 or lower would be considered normal in a man between the ages of 50 and 59. For men between the ages of 60 and 69, a PSA of 4.0 or lower would be considered to be normal. And for men over 70, a PSA of 5.0 or lower would be considered to be normal. Clearly, laboratory ranges vary quite significantly, so it's important that we're all familiar with the normal range represented in our own laboratories. Population screening with PSA is unhelpful in respect of prostate cancer earlier diagnosis, primarily because so many men with an elevated PSA level will not have prostate cancer.
One of the reasons that PSA testing is not recommended as a screening tool at a population level is the risk of overdiagnosis, which means picking up prostate cancers that would not have caused a patient harm in their lifetime. Overdiagnosis is a real problem because there are a reservoir of very slow-growing prostate cancers that actually won't cause a patient any problem whatsoever. These cancers can be detected using the PSA test and a diagnosis of prostate cancer made, leading to unnecessary treatment and the associated psychological distress that might ensue. And so it's very important when a man is asking for PSA testing that we help them to come to an informed decision about whether or not to have it, including clearly understanding the risk of overdiagnosis.
I think it's important to bear in mind that there are certainly men in whom prostate cancer is diagnosed who have an elevated PSA. We also see men with a normal PSA who have prostate cancer. And from time to time, we do encounter men who have a clinically significant prostate cancer detected who have a lower than normal PSA value. It is very likely that for most of those latter men that reflects the poorly differentiated state of an aggressive prostate cancer in which PSA secretory mechanisms are abnormal.